the increase in number of behavioral issues which we are seeing nowadays.
Mobile phones are the new babysitters.
Tantrums that they throw is beyond the concept or beyond the imagination of a parent. He should explore the world by touching, smelling, playing and all. There is a concept even known as virtual autism. Parental training is required for that. No parent will be directly willing to admit that my kid is having a behavioral issue.
Do you see a correlation between children who tend to consume more sugar, having a gut health issue, and also attention deficit?
Yes.
Or even autistic or pseudo-autistic?
We have to sit face to face. We have to discuss all these things regarding the child's health, gut, everything. If a kid is diagnosed with some conditions, means our intention is not to change that label. We have to find the able. That is what I have understood.
What does it truly mean to raise healthy children in today's fast-changing world? With technology shaping every aspect of our lives, parents often struggle to balance convenience with the long-term well-being of their kids. In today's episode, I am joined by Dr. Arun Warrior, who brings deep insights into pediatric care through the lens of Ayurveda. We explore the timeless principles of parenting, the impact of technology on child development, and how increased screen time is giving rise to behavioral issues in children. This conversation also sheds light on how the digital age is bypassing crucial phases of socialization for some children and what parents can do to restore balance. Hope you enjoy this episode.
Welcome, Dr. Arun. So happy to have you in my podcast.
Thank you for the invite.
Arun, many people are not aware of this branch in Ayurveda called Kaumara Pratyam. Can you explain to me what it is and what actually you do?
It's a wonderful question to start with. Actually, Kaumara Pratyam is the branch in Ayurveda which deals with the pediatric care. It is not just restricted to pediatric care. Beyond the pediatric care, it is a life cycle a human being should follow from the time of conception or even before until he passes off. So it is a completely a holistic approach in Ayurveda to the wellness of a human being. And to be more specific, say Kaumara Pratyam deals with the general wellness of the baby, the health issues of the baby, preventive aspects and all. And I feel that this is one of the branch in, when compared to other streams of medicine, which showcases the importance of a proper parenting. Because we use the word Kumara Bharanam in the definition of Kaumara Pratyam, which says that a proper parenting is an inevitable part of a human being's development. So that's what Kaumara Pratyam is.
Now, in your practice, how long have you been practicing?
I'm into Kaumara Pratyam since last 13 years.
13. So have you last 13 years, we've seen a lot of changes in the technology and the utility.
Yes.
Especially the last 2-3 decades, we see the technology boom and all of that happening. Have you seen a shift in the type of, patients means usually you will see parents bringing their children with different kinds of problems. Have you seen a shift in what are the common conditions that you see today?
Definitely. Actually, we can compare or we can say it as two different eras, the post-COVID era as well as the pre-COVID, because when the lockdown, everything came, parents were forced to keep their children in front of the screen and all. Already we have a tendency to give them screens so that our time will not be spared and we feel that they are getting engaged. But nowadays the result is showing. That is the increase in number of behavioral issues which we are seeing nowadays. I feel that one of the most important contributing factors, the increased gadget use or increase in screen time. There is a concept even known as virtual autism, where the child just passes the normal phase or he bypasses the normal phase, and many a time they loses the chance of getting socialized with the peer group and all. This may not happen in all children, but we are not sure about whom this may happen, because every child is having a predisposing element which may lead to a pathology or which may lead to a development and all. So if by any chance if a child is having such an instance, means definitely such type of exposures will be increasing the chance of having such type of behavioral issues. And interestingly, as when the age passes, we are having less number of children in our home and all. So the difficulty in expressing the emotions causes a great threat to the parents because they are unable to express their feelings and emotions in such kids and all. Even though they may not be 100% autistic and all, but still they may behave as of an autistic child, even though we don't have a term of pseudo-autism. But still I used to get patients with such behavior. When we go for the technical testing and all, that is, we will be evaluating the child and all, they may not be showing the technical scores of an autistic scale. But still, the patient will be on the other side. So I feel this is one of the most common thing which I have seen since the last few years after the post-COVID period or something like that.
Now, there is a term called mobile phones are the new babysitters.
Exactly.
It really helps them. Suddenly, when the child is crying and the parents want to do something, just give them the phone and it really calms them down.
Interestingly, to add to that, see, when you go to a medical college, you can see a new department there which deals with such type of addictions. We are familiar with the addictions of alcohol, of a drug and all. But nowadays, a new term, the mobile phone addiction, comes into play. And many pediatrics department are opening some special clinics with the help of a clinical child psychologist to deal with such conditions. Because the tantrums that they throw...
you mean the children?
Exactly. Is beyond the concept or beyond the imagination of a parent. So they'll be frustrated on one side because of their work and all. At the same time, they are not ready to accept the situation of the child. So this causes a dilemma in them. And often they'll be coming to us in search of a professional help. The number of patients, increase in such number of patients is the root cause of openings of such clinics and all. So I feel that this is a serious issue to be addressed. Because on the other hand, we are losing the concept of a group family and there is no one to share the emotions of even the adults, not the issue of the kids and all. So what happens is that all these emotions gets stuck up inside without causing proper ventilation. And I feel it is a complex thing. So that need to be addressed to the best possible extent, at least by the current clinicians with the help of a psychologist. Parental training is required for that. The thing is that parents always feel that once their child is cool and calm means they are okay. But see, that is not the correct method to have a proper parenting or something like that, because they should pass through all the normal phases in a pediatric age group. The term itself, we use explorative phase. That is, he should explore the world by touching, smelling, playing and all. So never try to bypass that particular phase. It is very important.
So you mean to say that somewhere parents are in a fantasy world that my child is very obedient, he's quiet, he's calm, he's very attentive?
To some extent. I would like to say like that because see, no parent will be directly willing to admit that my kid is having a behavioral issue. So especially in kids between 1 to 4 and 4 years of age, when they when they throw the tantrums, when they show some sort of behavioral issues and all, many often they'll be telling it because of the age, they are not having proper peer group interactions and all. But when coming to diagnosis, all these are highly significant. So more than a fantasy, they are all having a fear because everybody know what is this type of conditions and all. Everything is in our fingertips and all. So I think that it is a mixture.
And also fear of being judged by the community. Oh my God.
Exactly.
Something
Still
is
a
wrong.
society is not accepting such kids. That is a big challenge for us. But nowadays I feel that the groups like Autism Parents Group, the Down Syndrome Parents Group, they are doing a wonderful job. And the observant days, respectively, for example, the case of Down syndrome, we have an observant day. And on those days, we are gathering students who are, patients who are having this Down syndrome. They'll be brought to a hospital and we'll be arranging programs for them just to make at least the students aware of what is happening with respect to these kids. So I feel that such type of events should happen.
So what I feel in your condition, I think more than treating the child, counseling to the parents plays an important role there.
Yes.
So how do you educate them?
It's not an easy task anyway.
I can imagine. And they will be coming with so many of...
Exactly.
And they'll take, something is wrong with my kid. Just, can you have some prescription and just, that'll just solve the issue.
Exactly. When compared to the previous thing, this is a little bit different area. Because if a patient or a parent admit that my kid is having such issue, they might have read all the peer-reviewed publications that have been published in the academia, Google Scholar and all. And such type of publications may help to some extent regarding the conditions or regarding the possibilities. But on the other hand, being an Ayurvedic clinician, we intervene in a patient purely in a personalized manner. We have to understand the condition of the child. So sometimes in such an approach, we cannot give a universal advice as that of a other stream of medicine, because we have to understand if the patient is more of this type of prakriti or if this patient is coming from this particular desham and all. We'll be having some modifications even in advice, not just with respect to medicines and all. So such type of references may cause some difficulty in this advising. But on the other hand, even though we may experience the emotional outburst in the first sitting, but still if they are convinced with the issue means, they'll be with us. And I used to tell them that this is not a single man effort or an overnight effort. This is a team effort. We have to work. At the same time, the therapies should go on, because the complementary therapies plays a very crucial role in improving the behavior of such kids, especially the occupational therapy and to some extent physiotherapy in many cases, because on behavioral issues and all, we don't rely much on physiotherapy because they don't have this motor dysfunctions in general. But when later part of time, sometimes this motor dysfunctions can be seen because they'll be sitting idly. So sometimes they'll be in need of some stimulations. Otherwise, the occupational therapy, speech therapy, developmental therapy, everything plays a crucial role. So I used to tell them that, see, we have to sit together and the priorities for the patient. If a child comes to me with a serious issue like the seizure disorder, sometimes he'll be on a life-saving track from the modern medical stream. I never advise them to stop a modern medicine if it is a life-saving track. I advise them, we'll have some medicines along with this, which does not cause any complications. And once the patient is clinically stable means, I'll be again referring the patient to the respective modern medicine consultant and let him reevaluate. That is his cup of tea. Let him reevaluate. Let him advise them proper investigations and all. And if needed, let him take him for an EEG or whatever it may be. And if he feels that according to his principle, this has subsided, he'll be reducing the dosage. I feel that such an approach is creating a good rapport with the modern medicine consultants as well with respect to pediatrics.
And do you coordinate with them and collaborate with them?
Many times.
This has seen a fantastic result.
Yes, exactly. The satisfaction level a parent could get with such an approach, I feel it is fabulous.
I think that's the future of healthcare.
Exactly. The comprehensive approach.
Hello everyone. Today I would like to share an information about our upcoming 14-day immersive Ayurvedic retreat in Goa. Now, this is my first interactive workshop style retreat where I will be personally guiding each guest throughout the stay. Now, along with the Ayurvedic and Panchakarma treatments that I will be designing for you, we will also be engaging with scheduled lectures and interactive workshops on Ayurveda, healthy habits, bulletproofing yourself from burnout, and most importantly, integrating spirituality in daily life. The whole purpose of this retreat is not just to get the best Panchakarma treatments, but to go back with a completely new outlook of health and connection with your true authentic self. Now, the retreat is scheduled to start on 22nd December of 2025 until 5th of January 2026. It's exactly 14 days. Now, this is an exclusive retreat, which means the whole property where the retreat is going to happen is reserved only for the workshop participants. Now, the location for this retreat, this is our newly launched Sitaram Ayurveda experiences at the Postcard, Old Goa. Now, as we have only 6 rooms here, we can only take up to 10 guests maximum to ensure personalized attention and privacy to each of our guests.
I have seen some mothers come and say, and actually they go through a mental health problem when they get their children diagnosed with autism or ADHD. So somewhere they feel that they lost the genetic game of transferring good things. Somewhere they did a big mistake, or somewhere the horoscope is cursed. Though they go into deep kind of something, my life is lost, or I lost the game of life because I couldn't do the right thing to my child, or things like that. So in these conditions, how do you really tell them that this is not like the end of the world? I mean, it's just one phase. And what can you do as a parent to bring in an ecosystem where the child can also, find sometimes the weakness can be the biggest strength later on.
Yes. In such cases, what I used to do is I will allow them to have enough breathing space to explain me whatever they are feeling, because what I feel is in such issues, the single parenthood is one of the most commonly seen thing. It may not be always the mother, but in special kids and all, I have seen mothers leaving and parents, the father is only the caretaker of the patient. So, and as told by you, the society is not that much developed to accept such kids and situations. And these parents will be also having an isolation issue, not just the kids. So they can't go out for a family function or a marriage and all. So they don't have a space to ventilate again the emotions. So if somebody is there to hear the issues, means that is the most important thing which we can give them, what I feel. So I used to hear them first. Then I used to address the issues. I used to make them come to the reality. That is, if a kid is diagnosed with some conditions, means our intention is not to change that label. We have to find the able. That is what I have understood. That is, the ability is more than this particular label. And the approaches that we can give cannot be compared with another person who's having the same diagnosis. Especially, I used to see parents coming and telling me that my kid is having autism, and I prefer my kid to get trained in music. Because there is a misconception that all autistic kids are having savant activity and all. That is their high intellectual level, which may usually this autistic kids are compared with the kids who are having this high savant activity. So I tell them that, see, all autistic kids are not like the same. Because they feel that whenever your kid is diagnosed with autism, they can send the child for some other activities. But even though that is true, you have to find out the correct area for the sending. Sometimes your kid will be good in drawing. Sometimes your kid will be drawing music. We have to find out the correct approach or the intention or the desire of the child before planning for some particular activity. And even though we say about the non-acceptance society and all, there are various examples in front of us. When you search the Google in this high technical world, we can search the Google and all, you can get so many examples. I used to tell them, you can go and search many examples. For example, I used to compare with the example of a temple grantin. She's one of the renowned person who was having autism. And she is a successful person. And such type of examples, I admit that one sitting will not do all these things. We have to sit frequently. But still, if somebody is there to tell them regarding such examples that about a person in whom the society said that this person is not good for anything, and if you're telling that, no, it's not like that, there are some openings, that creates some sort of positivity in parents. So I feel that such type of interventions, and coming to the prescriptions and all, I used to write very small number of medicines. I maybe restrict my medicines to 1 or 2 medicines. I'll be giving just some Vilvadigulika or some mild kashayams and all. Because I feel that the cleansing of the gut along with the medical approach as well as such type of psychological interventions is most important. And coming to both of them, psychological intervention is more important. That is, the parents should be convinced with that.
Do you think the community plays an important role? One example that I would like to give. I know a real example of a couple who had a child who had some developmental issues, and they were diagnosed potential autism. And they were saying after moving to another country like United States, the support they got for the child is like overwhelming, and they feel more safe there. And they realized they don't want to come back to India. And they say that the community is still scratching the surface of how the care to be given to such children.
This is the true issue, because I used to address patients from outside as well. So when I talk to them, I can see the difference. Because outside the country, especially in other Western countries and all, they don't create this difference. At the same time, they can provide the extra care or extra therapy what the child is requiring in the normal school itself. So I feel that such a type of accommodative impulse should come from the society. That is need of that, I feel. And I hope that will happen. Not from the positive side, but I feel that when you take the incidence of the autistic kids, the number is alarming. When we compare to the statistics in 80s and all, it was just 1 in 20,000, something like that. But now the American studies says that out of every 56 kids, 1 kid is known autistic. So this increase in number of such type of diagnosis may create a society in which they are also included. So I feel that we are also
catching up.
Yes, I feel so.
Can you help me briefly explain what is autism?
See, even though there are so many definitions, so many explanations, everything is there, I feel that there is a little bit clarity less regarding the autistic community. Basically, a kid who is diagnosed with autism should show 3 features. The first one is there should be a difference in socialization. That is, according to age, he's not showing the socialization abilities according to the age. The second issue is sometimes the language may be difficult. Language regression can happen or the normal development will be compromised. The third issue is the restricted and repetitive behavior. Sometimes a child will be crying for the same dress. He'll be insisting to have food in the same plate and all. So these 3 dimensions that can be technically called as a combination to diagnose a kid to have an autism spectrum disorder. Based upon the intensity, we can classify it again. So I feel that just by having one single dimension, we cannot diagnose a case. And it is a pure clinical diagnosis as well. There is no need for a person to take the child for an invasive investigation or
no
other
blood
investigation.
test or nothing can give.
Sometimes that may help to find the extensivity, or sometimes it may help to find out the effectiveness of treatment and all. But on the other hand, a pediatrician himself or a clinical child psychologist can diagnose an autistic patient.
Okay.
Just by clinical symptoms.
And you also mentioned about pseudo-autistic. I mean, you don't use it, but you say that many times people are... Do you think it's overdiagnosed these days and misunderstood?
To some extent. As I told you, there is one another community who are very often searching for the health issues into Google, YouTubes and all. So there may be many pitfalls in between. Sometimes the person who's communicating regarding some minor issue may become viral, and the person who's seeing that may generalize that. So depending on such elements, without having a general idea or over-dependence of such things may create some issues. I feel that proper education, as we are doing, proper education is much essential in overcoming such things.
So don't go to a internet site and don't do a self-diagnosis.
Exactly. Even in some WhatsApp groups and all, we have seen, please don't look into Google before entering into my OPD cabin and all. It's quite common. The number is increasing.
You mentioned about this virtual autism.
Yes.
So what you mean is kids get so obsessed with the screen time and they don't want to socialize anymore because they are so engrossed in that. Is that what you mean by that?
The thing is that they'll be bypassing this normal phase, especially in the early phase. As the medical science says that brain development is not completed even when the baby is born. It's a continuous process. And there are various postulates to support various theories and all, especially in the initial phase. As I told you, the phase is known as explorative phase. He's supposed to see if I touch this glass of water, if it is warm, the first impression that I get is if I touch such a type of glass with such water, the feel which I receive is warm until I touch a cold water. Such type of experiences are bypassed during this initial phase, especially when overdependence of gadgets happen. And of course, they feel that such type of emotions can be changed with the help of the fingertip. If something that is not acceptable for their small brain comes, they can just change the channel. But this doesn't happen in life, isn't it? So they have to undergo all such normal situations with the help of a proper parenting to overcome such issues. Otherwise, what happens is that the normalcy itself will be bypassed. They'll be living in a virtual world. And it is difficult to bring back such children once the time gets delayed. As we say in Ayurveda, once the kalam or the duration increases, the disease becomes asadhyam or incomplete or completely curable.
So if I have to just look at the key takeaways of our conversation in the last few minutes. So it is like, don't self-diagnose. Don't rely on what you get in the internet.
Yes.
Get a professional help in diagnosis.
Exactly.
And then be very careful with giving screen time to the children. And sometimes the screen time can relate to something called a pseudo-autism, or they might even bypass this and they don't want to get into...
Yes, even though the term is not there, it's like pseudo-autism.
No, but I understand. It's a very good... I think slowly it will come into that part. You know, we have this differential diagnosis term.
Exactly.
And then counseling the parent plays an important role and getting them the right approach. And especially if they come from a very conservative community. I think they struggle a lot.
Yes. Yes.
So they really need to have the right support system to speak to someone. And as you said, even countries like Singapore, the support system they have for, and even if they get diagnosed with this, the support system they have for the parents and for the children is phenomenal. And I think we might reach there in few
Definitely
years,
we'll
or
reach
maybe
there. We'll reach there.
but it's taking time. But
Yes.
the idea is don't give up hope. And this is I think in some state where I saw, there will be like this place is marked for physically handicapped. Now they changed
In
that word
parking areas
in
and all,
parking
isn't it?
areas.
Yes.
In some states, I think in Telangana, where I saw, this is only for differently abled people.
Yes.
I
That's a
was
beautiful word.
how
which
they
we use.
reframed it.
Exactly. Nowadays, we don't use the term disabled
Mm.
because we don't know what is their ability. And
Exactly,
who are we
exactly.
to judge them? So they are differentially abled. And we use the term special kids because they are blessed in their own way. So I feel that the society is changing.
I think when I look back, why we Indian community or even the Asian community, when I meet especially Europeans or Americans and have a conversation, they tell me, oh, you Indians are so good at mathematics, you guys are so good at school. Then I look back, oh, maybe yes. Maybe the thing is, when I was in school, I still remember there were so many of my classmates, they were so good at sports, but they couldn't pursue it because the whole school was in a narrative, if you go to sports, you will die
Fail in
of
the
poverty.
exam.
Nothing, there's no future. You will be just one among them.
Yes.
And somewhere there was this whole narrative in the school that I went, and I'm sure you can also relate, that you have to study, you have to get good grades, you have to get a good job, and that, or maybe a government job. That's the future.
See, I used to make sure that I will ask a question to the parent or a child who's sitting in front of me. Let them come with a respiratory issue, let them be a constipation, whatever it may be. When they come to me, I ask them, what do you would like to be once you become an adult? And I can see the fantastic answers from those young brains.
Like how young?
1 to 5 years,
Wow.
once they start their schooling and all. Even after schooling, I used to ask them. So I would tell the parent, you never change this ambition and all. But the thing is that if the child is preferring to become a good football player, means he should be the best player in the world. Let you not change his profession or his intention. Sometimes the parent will be telling that he is very fond of football, but I want to do good in mathematics or some other branches of science. So can you give some medicine for that? This is quite common in the OPD. So I used to tell them that don't compel them, because see, the skill and attitude are different. If you have a skill inside, sometimes that will be shown as an interest towards some particular dimension. And if you don't have a skill, means whatever you try, you can just acquire a degree. That's it. So I feel that such type of skills comes out in this initial phases of, say, 1 to 6 years of life and all. And sometimes that may end up in fantasies as well.
Yeah.
Because many a time these boys come to me and tell me that I want to become a police officer. So I say that, see, today's 30 patients, 25 are becoming police officers. So what happens if 100 police officers happens to become within 1 week of time and all? So I used to tell them that sometimes this may change, but leave it that to them. And the parents should be giving maximum exposure of the respective groups to the particular students. Because once a parent came and told me that his child preferred to become a collector, I told him that very good. So you should show him some examples of good collectors so that he will feel that what he had felt inside is good. At the same time, to become that position, he had to work this particular way, because there is a conventional method to pass through until he passes the 10th standard and all. So such type of examples, sometimes that is also a job of the doctor to collect with such data, to communicate to the parent and all. And I definitely tell them that you never change the intention of your child, because some hidden talents will be there for sure. I used to tell the examples of Ronaldo and all when the patients come to me.
Example of?
Ronaldo, football player.
Yes, Ronaldo, yes.
Because I used to see many good football players in my OPD. 5-6 year old good football players coming into my OPD. Some dancers come, teachers come. And what I feel is the admiration that they are having when they see a good person. Sometimes he may be a singer, he may be a doctor. The traditional method of asking whom do you would like to be, a doctor or engineer, has been changed. Because that is one of the good aspect of gadgets. Because they are getting exposure to many areas. But if it is limited, means definitely the the good things happen for sure.
Now, how do we, deal with a child showing a tantrum? Because I remember I was watching a movie and a couple came with their kid, and the movie was going on, and this kid started crying, and the mother started panicking. Oh my God, this is in a community, and like a lot of people are there. She just took the phone and put some Baby Shark song, and the child is very calm. And I if she hasn't given that, the only other option will be to take the child and go out. Otherwise, they might just stop the movie because it was that loud.
Understood.
So when a child is showing tantrums, maybe you cannot stop it immediately.
Yes.
But what is the strategy? Maybe in 3 months, 6 months, how can we change that behavior?
It depends. It depends on the stimulus. It depends upon the other factors. See, the tantrums, a child once he is born means he's not knowing how to reach out to something. We know when a baby is born, he just simply cries. He feels when he feels hunger, if he's having a pain, the only stimulus motor thing that he gives is a cry. And Ayurveda says that once the baby is crying means you should suspect a disease if the baby is fed properly. That is the first thing you have to do is feeding the
Till
baby.
what age?
Usually until a child attains an age when he can express his emotions. That is, say, for once this baby attains a 9 months of age, he can say, this is my amma, appa, and all the bisyllables happens. As the age advances, these type of differences will definitely be there. Coming to tantrums, I feel that in the initial phases itself, the child should be convinced about the reality. That is, we should be a parent, of course, not on the other hand, the child should know that, see, if I cry for this particular entity, I will not receive this. On the other hand, if it is good for me, my parent will give that. This is the umbrella message which we have to give them. But this depends upon the age. We cannot compare a 1-year-old child in whom we are giving this message to a 5-year-old child who are giving the same message. If, on the other hand, if you could give this message 1 year itself, the tantrums will not go beyond the 5 years of age. This is with respect to the normal tantrums. But this can happen in behavioral issues as well. If behavioral issues happens means, see, their brain wiring is different. So in such cases, we have to give the medication, we have to give the therapy. At the same time, we have to give the counseling. In general cases, we can adopt such modifications by convincing the child. But often what I see is, this is usually seen as a single activity of the mother or the father. But it is not like that. When a grandparent visits the home and if they're giving some sweets means, sometimes a child will be on deworming treatment and will be giving a sweet means what happens, the child will feel that grandfather is having more affection towards me. So such type of things can complicate the issue. So I feel that the whole family should approach in the positive manner to address the tantrums in general.
Recently, I did a podcast with a very good nutritionist, and she was saying the love language of India is giving sweets. Because love language means there are many ways you show your love and affection.
Yes.
It could be your words, it could be, taking time. But I think she hit on the nail. Like, we have a tendency to give sweets. Like now Diwali is coming, now we have Onam, all the celebrations.
Yes.
And if we had a check on how the glycemic index of the population goes up in each festivals, you will see what it does to our community.
Yes, coming from an Ayurvedic community, I would like to say that we have 6 rasas, and out of this, the sweet is not the exclusive rasa. But see, we'll be having a feel-good process while having this sweet taste. The dopamine rush will happen. And I feel that may be the reason why we often we don't give a bitter gourd as a gift and all, isn't it? We give a sweet instead. I feel that the dopamine rush is resulting in such type of compliments and all. But on the other hand, as we were discussing previously regarding the cravings and all, this is causing a great issue. Because see, even the modern medicine says that in case of a seizure disorder, I would like to say with an example of seizure disorder. In case of seizure disorder, you have to reduce the sugar. You have to reduce the direct sugar, because direct sugar will increase the chance of having a seizure disorder.
Seizures.
Yes. So starting just from a worm infestation, this can lead to complications like seizure itself. So it is not a simple childhood play game. It's a difficult task. It is a different area as well. So I feel that we have to keep a check. Cravings will happen in all human beings for sure. It is quite normal. So we have to find out the cause, because many a time the cravings is not just out of the childhood age group or something like that. We'll be having some nutritional issues. We'll be having some sort of psychological issues. For example, you might have heard about the term binge eating.
Mm-hmm.
If a person is depressed or has some emotional issues where they'll be start eating. So cravings can happen with respect to disease anxiety as well as case of normal kids in whom we don't have a check. So I feel that in normal kids, we should educate them regarding the importance of having a proper nutritional diet, all the importance of all 6 tastes in their daily food items and all such things should happen. So that's it.
Do you see a correlation between children who tend to consume more sugar, having a gut health issue, and also attention deficit?
Yes.
Or even autistic or pseudo-autistic?
I feel that more than the concept of sugar, the current sugar, that is the chemically bleached white sugar, is creating more issue. Because in case of a small kid, we cannot 100% avoid the sugar taste. So what I used to advise the parent is, you can go for the biologically bleached sugars like that of a brown sugar and all, which is very commonly available in Ayurvedic medical shops and all. But preferably keep the child away from the white sugar or the refined sugar. Because I have seen the improvement in cutting down the sugar. Because when we give a diet advice to a kid who's having a behavioral issue, we'll be focusing on some areas. Out of that, the most important thing is cutting down the white sugar. So definitely I can see the improvement that is happening in them. And I feel that the modern world is discussing about the sugarless diet, a sugar cut diet. Along with that, the modern science is discussing about the cosmetic aspects as well. Once you cut down the sugar, your complexion will increase. All these things comes into play. Coming to our area, I feel that the gut health is much compromised by the intake of such refined food items, not with just sugar, with the help of all sort of refined food items. If you give a complementary feeding with respect to a fine powder, if you give paratha, maida, so refined foods will definitely disturb your gut health. This is the general thing. In some kids, it may not happen, but that is not the general thing. So we have to focus on general thing being a clinician. And the exceptions are truly different.
I think we have limited, we talk about the 6 tastes. I mean, before we had the knowledge of calorific value or nutritional facts. I mean, our tongue was our laboratory.
Yes.
We understood things by the 6 tastes. And that was the first nutritional advice that we had. And once you are able to have all the 6 tastes, that is how we decode the energy on different things. So like we said, a wholesome nutrition is having a combination of all the tastes, not just, dominated by one of them. And on the other hand, which talks about the evolution of brain, and our brain is actually designed to make us consume as much sweet, salt and fat. Because that is where in the nature, this is where energy used to be there. But along with that, there are other tastes also that will help to balance it.
There comes the role of a clinician to explain regarding the benefits of these things to the parent. Because just satisfying the taste is not the matter of nutrition. Or just thinking about the body mass index is not the matter of nutrition. Because in my OPD, I used to see kids who are having good body mass index, who are having good height, weight. That is, they'll be fine with respect to their anthropometric measurements, height, weight and all. But still they are getting disease regularly. WHO says that a person should be told as a healthy person if he is healthy, not just with respect to the physical entity, but his emotion, intelligence, everything should come hand by hand. And I feel that that is where the Ayurveda plays. Ayurveda advocates the functional wellness. So for having a proper functional wellness, the advocacy by the Ayurvedic textbook must be followed. That's what I feel. Out of that, the Aharam plays an important role. And in case of kids and all, I would like to add something is, in case of kids and all, the classic says that Aharam or the food is the best medicine that we can give them. Especially when I quote the Kashyapa Samhita, that is one of the most important Ayurvedic pediatric textbook. It says that Aharam is Mahabhaishajam.
The great medicine.
Exactly. So fine-tune and modifications of medicines or Aharam is much essential for a proper gut health.
So what could be a good actionable takeaways for the parents who struggle to think what is the right nutrition? Because we have a huge influencers coming and telling them what to give, what not to give.
My stand on that is preferably stay from such advices because your kid is unique. The gut health of your kid may not be compared with the gut health of another kid,
Mhm.
even though he may be a twin brother or twin sister or whatever it may be. It is purely subjective. We have to meet an Ayurvedic clinician. He will be advising based upon the diet habits, based upon the, as we discussed previously, the climatic change. See, we cannot have a universal advice to be followed throughout the year. It will be different. The advices which we give during the rainy season will not be the same as that of in the winter season. It will be changing. So advices regarding the gut health or maintenance of good health cannot be universal at all, for sure. Because if you follow, for example, let me tell you, that is in case of a cold climate, sometimes we'll be advising them to have some ghee and all. If this is given regularly, means at some point, the kid is not just a laboratory animal. He's getting exposure to all the environmental features also. So if by any chance he's getting an exposure to other entity, which may increase the chance of a respiratory issue, means there we have to advise him to stop the ghee. So this should be checked frequently. This is the only method to address the normal gut health of the child.
Understood.
Do not follow general advices. You have to stick on to the particular uniqueness of the child with the help of I would say, a family physician. So he'll be knowing better the child.
Now, we definitely agree with the point that too much of refined white sugar or white flour or wheat flour, like maida, for example, this can lead to a lot of gut issues because there's hardly any fiber, there's hardly any good micro and macronutrients. So in these conditions, would you suggest how do we train the child to appreciate other tastes? Like children, they will have a sweet tooth. We adults, we have a sweet tooth.
Yes.
How do we train them for that?
I think it's just a matter of good parenting, because we have a concept in case of diabetes and all. We say you avoid rice, you add wheat. Modern medicine says that it's a very small difference. It's just because of the reality that if we are taking a wheat, we are advising wheat in a person in whom he is usually taking rice, means he cannot have a more quantity of wheat. That is the logic behind that. So such type of advices should come from the parent. If you regularly use some sort of food particles at home, means definitely the child will be fed on that and he'll be having that congeniality. So I feel that if you feel that this is not good for your child, means you also should refrain from such activities. This is very important, especially in case of this wheat and all. Wheat contains a protein known as gluten. And gluten sensitivity is a great issue in behavioral issues as well as in GIT issues. Casein, milk protein, it is also an issue with respect to GIT issues as well as the behavioral issues. Even we have a concept of gluten-free, casein-free diet, especially in case of kids who are diagnosed with ASD, Autism Spectrum Disorder, or ADHD and all. So I feel that if the kid is kept away from chapati or roti in a home where the parents are eating chapati and roti, means that will not work. The child may show tantrums. At the same time, the parents should switch on to some other aspects, because we have many other options. We have millets, we have pulses, we have many other options. So I feel that the family itself should change to make the child adaptable to a new taste or whatever it may be. If you cannot command a child to take bitter gourd if you're not taking bitter gourd. That is what my stand is. So at least show him, this is good for me. So definitely this will be good for you too. Because the child gets convinced fast by examples beyond the words.
Like we are great imitators.
Exactly.
Like, they don't do what you tell them. They do what you do. Like there is a meme or a cartoon I was seeing. Two mothers with their respective children. So one mother is holding the phone and her daughter is also holding the phone. And there is another mother sitting with the book and her daughter is also sitting with the book. And the mother holding the phone is asking the other mother with the book, how do you manage to
keep your child from the gadget
and how is she reading the book? So it's like what you do is what is actually followed.
Yes, correct.
And there's another story, like if the day I struggled to get my child to do the homework, and one of the things I noticed was I used to tell her to go and do the homework while I was watching the TV. I tell her, please stop watching and go and do the homework. And the only thing that really changed is I also stopped watching TV and I sat with her to do the homework. Then she realized, oh, homework is something very important. And
see, parenting is a beautiful art. Parents should be trained for that. Very important thing, because what I feel is the environmental factors plays a crucial role in development in a case of a child. And out of this, the activities shown by the parent is an important environmental role for the child. So not just with respect to the behavioral issues, but for a proper society to develop, I feel that every parent should act in a manner that they are accommodating their child in the best possible manner. So it is a very important thing. And I feel that is the least discussed area also. That's what we start from. I told you regarding Kumara Bharanam as a part of Kaumara Pratyam. So I feel that we are fortunate to have this particular branch of science which advocates importance of proper parenting in managing the kids.
Now, Doctor, we see in Ayurvedic textbooks, we have a lot of emphasis on worm infestation, like Krimi Chikitsa. Now, how do I know if a child is going through a worm infestation in a basic analysis? And that is a sign that I have to take him to a clinician and get help.
Wonderful question. The thing is that many often clinicians feel that a baby is having a worm infestation just with the presentation of a itching, the perianal itching. But what I feel is Ayurveda says that the perianal itching is a presentation of a single type of worm. It is not the exclusive presentation of a worm infestation. On the other hand, we have to search for other areas of presentations as well. Classics say multiple presentations, starting from loss of appetite. Sometimes the parent will be coming and telling you that my child is having sufficient quantity of food, but still he is not gaining the weight. He is having recurrent respiratory issues and fever. Such type of presentations makes me think about the possibility of giving a deworming treatment. And the deworming treatment in Ayurveda cannot be compared with that with the modern parlance, because it's not the same thing. It's not the same. It's not the same. It's different thing, very different thing. Even though the term krimi is oftenly confused with the Malayalam term as well as the Sanskrit term and all. Coming to Sanskrit term, I feel the deworming thing or the pinworms that causes the perianal itching is a small entity of the umbrella term of krimi. So I feel that in pediatric age group, we have to check for the possibilities of these presentations, as I told previously. Along with that, we have to see for the behavioral issues. All these things comes into play while diagnosing a case of worm infestation, because Ayurveda says that certain age groups are predisposed to have certain conditions. We know that, isn't it? Especially in case of old age,
arthritis.
We are exactly arthritis. In case of the middle age, we can see the acidity, the metabolic hair fall, metabolic issues. At the same time, when we come to the kids, we are very commonly seeing respiratory issues, this worm infestation and all. So Ayurveda throws light in this dimension that even though the kid is coming to you without a perianal itching, we have to keep an eye on the chance of having a worm infestation. From there, usually we start a treatment. If a patient comes to us, the worm treatment or the deworming in the sense of Ayurveda, not just by giving one tablet, it is a sequential approach based upon the type of krimi and all. We will be giving a sequential or periodical approach. We used to continue this treatment for say a period of 2 or 3 weeks. That is a very less potent medicine will be given, which may address the gut issue in total. And if by any chance he is having a worm itching or the perianal itching due to a pinworm, means that also will be addressed along with this particular thing. And I feel that this is the heart of Chikitsa in Ayurveda. Having a proper gut health before entering the respective treatment should be done in all patients, not with respect to the kids and all. Especially in kids, we have to definitely focus on this particular dimension. The role of various medicines like Krimiknavati, Krimishothani, Golika, so many medicines are available in the market. And I feel that a judicious administration with the help of a clinician will definitely help the child outgrow from such conditions.
So you're saying that perianal itching is not the hallmark of a child who's having a worm infestation.
Yes.
It's just maybe one aspect where it is very widely blown out.
May not be in that dimension. See, perianal itching is caused by just one single type of worm. That is a pinworm. We have other types of worms as well. We have a hookworm inside our body. All these things can happen. So Krimi Chikitsa not just focuses on the perianal itching. Of course, it is having an affinity to address the perianal itching, but still on the other hand, it is a holistic approach. The gut health maintenance is the most important thing. When we compare with the modern medicine also, the life cycle of these worms also, we can get a clear picture because human is one of the host of these types of worms. So when it enters the body means it should complete the life cycle inside the gut of a human being. So if you could maintain a proper gut health means definitely it will be helping us not to such conditions. So I feel that the approach in Ayurveda is a better choice with respect to deworming treatment.
Like I am a big fan of prescribing Krimignavati. I mean, not just to children, even for adults.
Yes.
Like every time I see an allergy, this is one of my favorite. But I would like to iterate all the people listening, don't self-prescribe this. Get a proper consultation and do that.
See, in Ayurveda, we study one big chapter for Krimi Chikitsa, isn't it? I feel that is the extensiveness of Krimi, the term Krimi in Ayurveda. It is not just with respect to perianal itching.
If you have to make a common man understand the spectrum of Krimi, how would you do that?
I would like to tell them that, as I told you, there are some issues which are very common in some particular age groups. And this predisposing element is due to some factors which is very common in that particular age group. I used to tell them that your kid will be having some sweets, your kid will be having some normal food, which may include ghee, curd, everything will be there. These type of food items, at the same time, some unhygienic elements will come into play because they are kids, they are in the explorative phase. These things will contribute. Your unhygienic factors comes into play. All these things works together in manifestation of some particular type of diseases. Out of this, the manifestation of Krimi is more important. And I make sure that, see, you don't rely on the possibility of having a perianal itching. Instead, even though you feel that the child is not comfortable with for example, if the quantity of food the child is taking, he is not gaining weight. He is having recurrent abdominal issues. He is having a tummy upset. Sometimes a parent may come and tell us regarding the possibility of having a mesenteric lymphadenous-like issue. In such case also, we used to advocate the Krimi Chikitsa. The tummy upset is there, heavy pain will be there without any nausea or vomiting. The periumbilical pain will be there. In such cases, we used to do Krimi Chikitsa. At the same time, the baby is not gaining weight. Baby is still coming under the age, weight is less than the age group. In such cases, we used to advise the Krimi Chikitsa. And interestingly, by doing Krimi Chikitsa itself, the issues gets addressed. If you do exactly, if you do a proper chemical as told by you, I have seen drastic relief in allergic response in case of kids. So I feel that this is one of the important entity that should be practiced regularly. And I used to advise the parent that even though your child is asymptomatic from your purview, please talk to us. We will sit together every 6 months break. And if I feel that this is required to be addressed, means definitely you have to take the Krimi Chikitsa. And what I feel is the hesitation from the part of a clinician is one of the important negative thing is. So if you could talk properly to the parent, means they'll be with us. Because we have to convince regarding the system. We have to convince regarding the possibilities. So if you could convince them, means they'll be coming to us. Every parent will be thinking that my child could get the best possible thing, isn't it? So I feel that proper communication should be there. And you have to convince them regarding the reality. You cannot make them in a fantasy world because they can search all these things, and even Ashtanga Hridayam is available online, so they can search all these things.
Now also, there is a correlation that if there is a worm infestation, even though they don't have any anal itching or some of the symptoms that you mentioned, one of them could be sugar cravings.
This is connected.
Yes.
This is connected. It is a cyclical thing as well. See, many of the time we use the term paika. Paika is the eating of unedible substances. That is, the child will be eating the sand, he'll be biting at the tip of the pencils and all. This may lead to worm infestation. This worm infestation again leads to paika. Similarly, in case of sugar cravings, as I told you, it is not just the need of the child. It may be connected to some nutritional issues as well. If we have a nutritional deprivation, for example, if there is a magnesium deficiency inside the body, you'll be craving for such things. So it is a cyclical thing. If you are not addressing this issue properly, means it again increases the cravings. So it is a cyclical thing. So we have to find out the cause for this. That is the reason why we are stressing on the fact of personalized approach. We have to sit face to face. We have to discuss all these things regarding the child's health, gut, everything. We have to make a separate prescription for the child.
But on the other hand, sometimes I've seen parents being very strict. And I'm sure if you have read about this concept of hygiene hypothesis, when they don't expose themselves to certain unhealthy things, that leads to immunity issues.
Yes. See, we have two types of immunity, you might be knowing. We have an innate immunity as well as we have an adaptive or the acquired immunity. Out of this, the acquired immunity should happen only after exposure.
Yes.
You cannot expect an immunity all of a sudden. You have to get exposed to some things for having an active, for this acquired immunity. See, we have other options like vaccinations. We have options like giving immunoglobulins. Everything is there. But what I feel is, see, as I would like to quote an example of RSV virus, respiratory syncytial virus. I feel that more than 80% of kids are getting this infection in the initial phases of life. It gives an acquired immunity. So such type of immunity should happen, because I'll be telling the parent that, see, your child is not meant to be kept inside a showcase. They should get exposure to all these things. Sometimes they'll be getting a mild cold, mild flu. Everything can happen to them because we're all human beings. We cannot change the exposure to all these things. Even in Ayurveda classic says that the concept of Janavadodhamsaniyam, the exposure towards the impure atmosphere, the water, the desham and all, isn't it? So we cannot keep the child away from all these things. On the other hand, if such issues happen, means try to address the issue in the best possible manner with the minimal potent medicine. That is what I advise them. And I feel that once the parent is convinced with this particular reality, means they'll be with us. They'll be with us.
Like if you listen to or if you read books of Raghavan Tirumala, he's so obsessed with Agni. So and there are some doctors, they are so obsessed with Krimi. And I feel when it comes to children, I think just like how for the middle-aged, we have to look at the metabolism, ama. For children, I think Krimi should be the first line of treatment.
Yes, that's what I was telling you. That is, the chance of having some group of conditions should be there in a clinician's mind, even if the patient is asymptomatic in that particular dimension. This can be better explained in this manner. If I am giving a medicine and if this medicine contains more sugar, or if I am advising them to have this medicine with jaggery for longer duration of time, in some cases, this jaggery itself may predispose a Krimi. So we have to keep this in mind from the concept of having the chance of having Krimi in pediatric age group. So it is a very important thing. You cannot skip that particular idea. It is very important. And we used to see the increased incidence of APD, acid peptic disease, in case of teenagers and all. And when we look back retrospectively, I used to see patients who are more on katurasa, ambalam and all. They are very fond of pickles, the highly processed ones, the pappadam and all. And once they passes the Balyavastha or the pediatric age group, means they are already having a tendency to have such issues in the middle age. And now their body is ready to get into this particular thing very easily when compared to another child who's not exposed to such things. So keeping an eye on all these things will help them in moving on to such dimensions. If you could advise them that now it is okay, when the age advances, there is a chance for you to have an amlapitham or acid peptic disease. Such advices, if taken seriously, means
it will have an impact.
Definitely will be helping them.
I also would like to share an example. One friend of mine, his son is obsessed with cricket. Like he's only about 5 to 6 years old. And he was telling he had a terrible sweet tooth and some of the symptoms of worm infestation. So what he did, do you know what Virat Kohli eats, like a famous cricketer? So he doesn't eat sugar, he exercises, he eats a lot of salad, high fiber. And then the kid is like, okay, now I have to be like him, so I also start eating. So somewhere parents have to get creative in identifying what are they ambitious about, and then tell them, if this is what you want, this is the price you pay for it, and you have to let go of that momentary gratification and delayed gratification.
Exactly. I feel that along with that, the type of rewarding is also much appreciated in them. The type of positive rewards. And those rewards should not happen in the manner of sweets. I used to tell the parents that you just make a paper, you just make a note. So today, this kid studied for 1 hour. After 1 hour, he played for 1 hour. He had a nutritious diet. So you give 1 star in a particular day. Once it acquires 10 or 15 stars, you give him a toy or something like that. See, this type of rewarding creates an intention inside the small brain.
Yeah.
Where they are fond of such, we are also fond of appreciations, isn't it?
Yeah.
So I feel that such type of rewards should be there. Many a time we forget about positive rewarding. We think about negative rewarding only, isn't it?
Yeah.
Negative reinforcements.
Like the great economists, they have the statement, if you want to change the behavior, change the incentive. So I think the incentive structure of what's in it for me, like if there is nothing else, then let me just enjoy the sugar. It's okay.
I used to give stars to patients who was coming to my OPD. And I'll tell them that if you take Kashayam, I'll give you 2 stars when you come for the next time. So parents tell that just for the stars, they are taking Kashayam.
I think we are a very reward seeking animal, and that makes a
human
big,
is like that.
I think that makes a big difference.
Yes.
Now, coming to the respiratory problems, and we see that, the first part of a human's life, the babies, they have this problem of respiratory problems. And then it goes to pitta-related problems.
Exactly.
Kaphaja problems in the beginning, then
Pitta, then
Vaitika, and then Vataja.
Exactly.
So now we see a lot of respiratory problems. Sometimes kids having asthmatic problems. So you feel approaching the the worm infestation, doing a proper treatment for that will have an impact on this as well.
Not with just a Krimi. In case of all issues,
It could contribute.
Yes. Because as I told you, as told by you, Thirumal Pat sir, the focusing on Agni is the crux of Ayurvedic treatment. Agni hi samrakshanam hi chikitsa. That is the protection of Agni in its true activity is the concept of chikitsa. So I feel that when you have a deep dive into the details of the patient, like that of a respiratory issue, constipation, or whatever it may be, you can see at some frames, you can see the impairment of Agni. So addressal of the Agni is the end entity which we focus on. You may give some medicine with respect to respiratory issues. You may give some medicine with constipation. All these things you can give. But at the end of the day, the objective is to maintain the Agni. Because we'll be asking questions to the parent, not just with respect to respiratory issues. We'll be asking about the appetite. We'll be asking about the type of food that the child eats, the quantity, everything we'll be asking to them. So the concept of Agni can be addressed only by following the concept of deworming treatment. And of course, the respiratory issues and all is becoming a big cup of tea for all of us. Because the incidence is increasing on one side, and the parents is always having a fear to making their child exposed to high potent medicines. So they are all in search of alternatives. So they used to come to us. Previously, when we were studying and all, we will be very commonly seeing developmental issues in our OPD, isn't it? But nowadays, what I feel is we can categorize the patients coming to OPD into 3 groups. First one, of course, the kids who are having developmental issues. The second group is the general pediatric case coming to us. And they used to come us with fever, respiratory issues, constipation, skin lesions, diarrhea, dysentery, everything. The third group is a different area. That is a general wellness group. So I feel that Ayurveda is becoming more accommodative. And respiratory issues, I feel that we can do a great job in respiratory issues. We can give the modifications of medicines. Many people feel that Ayurveda is just giving some kashayams and all, and they fear to take the child to doctors. But I would like to say it is not just a matter of kashayam. If you want to give kashayam, means we don't have an alternative. We have to give kashayam only. But on the other hand, we have other options as well. So I feel that such type of approaches is making Ayurveda more acceptable with respect to the general pediatric cases, especially respiratory issues.
No, I can so relate with it, because during my childhood, after I finished my school, I used to be with my father in the pharmacy and I used to steal all the jaggery there. And whenever I fall sick, they give me kashayams, and I had a very strong negative relation with Ayurvedic medicines. So this was one of my approach. So I can understand why children, especially with kashayams, they have a fear with this. But there is a lot more to do other than this kashayam, and I think people are getting more aware of
what
this.
I would like to add is, this is a prejudicistic aptitude of the parents. What I feel is, if you could train the child to have all these tastes, means they will be having all these things. I feel that many of the Ayurvedic doctors have their kids at home. They'll be taking kashayams. They're also human beings. They are taking kashayam. They're taking the bitter taste, everything, isn't it? We are prejudiced. We are prejudiced in the thought process that kashayams are not meant for the child. Ayurveda says that a medicine works in different dimensions. Sometimes the taste may be the responsible factor for action. Sometimes the potency may be the action. Sometimes the quality will be the action. So similarly, a medicine should work inside the body of a human being in different manner. For that, if taste is the exclusive factor, means that taste should be given for the particular child. This is where the concept of the previously discussed point among the taste of 6 rasas and all is ended. So I feel that we can make them use all these things if you are giving them this medicine in the comparatively early ages itself.
Like I gave you this example of the friend who told his child, if you want to be a cricketer, you need to have. And now after listening to this, he goes to a party. He says, I cannot eat food here. There's only cake and sugar. I need more salad. That's somewhere that grit has come.
Yes.
And I think it's all about they imitate you. And I think the best, I think one of the Ayurvedic physicians is say when the child is sick, you need to treat the mother. In a way, you can
Yes.
also look at it like
Yes, yes.
you need to also the lifestyle change in the parents is having a huge impact on
Impact.
the initial
Yes.
wiring of the brain of the child, how
Yes.
they look at food, how they look at lifestyle, how they look at screen gadgets.
Yes. Definitely. Definitely.
I think so if I have to bring the takeaways, don't limit your child in the narrative that you think how the child has to be. The child is a soul and you are just a medium to
He's a
give
different
space
person.
for the child to
He's
come.
a different person. He's a unique person.
And you cannot take full authority on the child. The child has their own journey to go. And in that, there will be a lot of misconceptions, prejudice. Let's let the child explore.
Yes.
And as we know, screen time and sugar, these are the two biggest enemies that we see. But it's not that we should eliminate, but give them a right incentive and tell them.
Because in this world, we cannot keep them completely away from all these things. Because playing a role in life means you have to accommodate all these things. So we have to give them their liberty. At the same time, they being the kids, we should take appropriate action to keep checkpoints.
I still remember one parent came with their children and said he used to be very well behaved till the grandparents came, and because the grandparent wants the attention of the child, I'll give you my phone, and that spoils them, and then they get used to that. Okay, now I'll go to my grandparents and they start doing politics.
Yes. This is a difficult task, especially in case of behavioral issues in kids and all. I used to ask the parent, you bring all your family members, so we'll sit together and discuss. Otherwise, what happens is that if the mother is only there, means she feels it is only her responsibility. So when we communicate something, means she might be much stressed because she couldn't accommodate all these family members. We'll be asking them to keep the child away from sweets, gluten and all. In the family, they'll be making chapatis and all. So until the whole family members are convinced about the reality, it becomes a difficult task for us to continue the treatment.
And never underestimate the krimi chikitsa in Ayurveda. I think that's an
Yes,
important
yes,
takeaway that you
yes.
mentioned. It could be allergies, it could be attention. Now, one more thing, last thing. When parents come and say, my child is not able to have attention, what is some basics that you can do?
First, I would like to comment on the krimi chikitsa again. I would give them the proper krimi chikitsa because, as I told you, many a time the inattention can come out of improper deworming or chance of worm infestation. On the other hand, we have to search for the possibilities of attention impairment. See, our brain is wired in such a way that we can use the maximum potential of the brain by giving the training in proper manner. If you could train them, see, if you try to teach them meditation, means initially we know we will not be able to focus. But on course of time, we can accommodate that, isn't it? In case of a normal brain, this happens. So in a child in whom there is no other issues with respect to development, behavior and all, means we can give proper training sequentially. But we have to convince the parent that, see, by giving some Brahmi or by giving some other medicine, Chavanaprasham like that, you cannot make this child completely cured after 1 day or 2 days. It is a comprehensive approach. You have to give him some psychotherapy or some counseling or whatever that is required. Along with that, proper gut clearance should be made. And the interest of the child is also equally important. Sometimes I have seen kids who are going for some play activities and all. Sometimes they may not be interested in play activities. So they cannot focus on that activity because of their non-interest in that. So I feel that all these things should go hand by hand to address the case of inattention. At the same time, inattention can happen with respect to other behavioral issues, especially in case of an ADHD, attention deficit hyperactive disorder. And inattention can happen, but that is a different area. Because that is a developmental issue. We have to address it comprehensively there.
Do you see a lot of patients coming with ADD or ADHD?
Yes. As I told you, the number is alarming. Number is alarming. Quite.
And do you think it's
alarming.
overdiagnosed or it's underdiagnosed? Or?
To some extent, it's overdiagnosed. Then underdiagnosed. To some extent. Because as I told you, everybody is very fond of this Googling and all. So even some minor ailments may lead the parent think about the possibility of ADHD. ADHD should be diagnosed properly with the help of a clinical child psychologist. You cannot just say your kid is hyperactive just by seeing some activity at home. Sometimes a child may not show attention. I have seen a parent coming to me and telling that, doctor, my child has scored 10 marks less than last year examination. So I suspect an ADHD. They are not aware of the gravity of this particular term, ADHD. Once you give a label, means it is a label. So I would like to tell them that seek a professional help before coming to such conclusions. Because congenital anomalies are some labels which is very difficult to get reversed.
Once you put that.
Yes. I have seen some prescriptions coming to me with question marks, ADHD question mark. After, sometimes patients may go for some doctor purchasing. They'll be meeting many doctors. And at some point, they'll be losing this question mark. Then it becomes a diagnosed case of such issues. So even if I get such conditions, I used to advise them to go and meet a clinical child psychologist for proper evaluation. Because it is a matter of life. So
it's such a difficult part. I think it was Krishna Kumarji was telling that it's very easy to diagnose people into pseudo Alzheimer's because we all forget many things.
Yes.
But that doesn't mean you have Alzheimer's.
Yes.
Same way, children, if it is interesting to you and you will put your focus, but if it goes beyond a certain limit and if you're not able to put focus on some of the basics.
Yes.
And I think we are looking at a superhuman kind of a traits in children. Many parents are expecting that.
Yes.
And
the
that is creating
over-ambitiousness of the parent. As I told regarding the autism, we have a separate clinical assessment criteria to assess the ADHD. And to the parents of such kids, I would like to say there is an option. There are options in Ayurveda. There are options in Ayurveda along with the modern medicine as well as the complementary therapy. But on the other hand, I request the parents to not to overdiagnose kids who are showing some mild presentations of such issues, either differently. Sometimes in case of language and all, sometimes they'll be not getting proper stimulus. If there is no absence of stimulus means, sometimes they'll not be able to communicate properly. So just by thinking about the language dimensions, they'll be coming to us in a fear of autism. That may not be a case of autism. So the professional help is much, much appreciated in such cases.
Thank you so much, Doctor. It was a lot of, I'm sure there are many takeaways for many people listening to this. And we discussed about the Krimi Chikitsa, which I want to reiterate again. We spoke about how, changing the lifestyle of the parent is the way to change the behavior in the child, and changing of incentive, train them and appreciate them for, appreciating the other taste other than the sweet. This is one thing that you mentioned. And also don't be so obsessed with labeling. Like maybe you will see some traits, but give it some time. Maybe the time will heal itself, or maybe you need to take a professional help. But somewhere parents tend to panic. If this is the case, what will happen to the future? Okay, if it's a boy, will he get a girl? If it's a girl, will she get a boy? They go to such an extent. Just give it some time, and that soul has his or her own destiny and journey, and you are just a medium that is supporting there. Let's not take full responsibility and ownership, and give them the space to explore as well and make mistakes and try new things. I think giving a lot of counseling to the parents itself will solve a lot of this. I think that's one of the takeaways that I understand in this. Anything else you want to share, Doctor, in your experience, what the parents would like to hear?
The thing is that the most important thing is, as told by you, don't be over enthusiastic. All are quite humans. Everybody is having their own potential. If we could find out the ability of a child, let him be a otherwise normal child when compared to a differentially able child, even in such cases, find out the thrust area. And if you could give a proper training, means today the world is much, much bigger when compared to the previous time and all. Every job is having its own, the biggest moment to be shared. So I feel that preferably don't compel the kids to stick on to some particular ideas, because sometimes their brain will be showcasing much beautiful things than what we imagine. So at the same time, proper parenting should be there, because they are not aware of the loopholes or pitfalls in the society and all. So this is what I would like to share with them. And Ayurveda is an area where you can 100% relay, where you can get a professional help with respect to your general pediatric issue, a developmental issue as well as for the wellness. It is not just a matter of knee joint pain or arthritis, something like that.
Yeah, there's a huge part, and I'm so glad I got to interview you in this.
Thank you so much, doctor.
Thank you so much, Doctor.
Thank you.